All right, you'll turn the clocks ahead 1 hour when you go to sleep Saturday night, spring forward. If you're like me, you might dread the start of daylight saving time, but my guest on First at 4 would like to see this as an opportunity, a chance maybe to look at your sleep habits and make some changes that might help you feel a little bit better during your waking hours. Dr. Joseph Ogile is medical director of the Clayton Sleep Institute. Great to see you. Thanks for coming. So sleep too little and you run the risk of things like congestive heart disease, diabetes, depression. Sleep too much, you run the risk of the same diseases, and you can even add stroke onto that list. So what's right for us? How do we know how much sleep each of us as an individual should be getting?
Well, you're pointing out some interesting data, which is that the correct amount of sleep we need, on either end of it, too much or too little, there's health risks associated with it. Why people sleep too much or too little is unclear to us at this point, but how much is healthy for us? The National Sleep Foundation just released a very nice study combining specialists from a broad range, pediatric, psychiatry, neurology, and then people can go to sleepfoundation.org and see the range of sleep that's healthy for them at their age. It's an age-driven amount. For instance, very young babies or infants should sleep much more than folks in the age groups of older, middle age, older age.
You're gesturing toward me, older, middle age. Got it. Well, and this was really specific because teenagers, for instance, are split up into like 3 different groups, right?
That is correct. And it's the first time this has been done in this way and using scientific data to set the ranges. So the expert panel that met for almost a year looking at all the available scientific evidence and setting these ranges based on the best data available.
Okay, it's really interesting, and again, we're going to have that link. We tried to show you a graphic, but there's just so much going on, kind of hard to take in just one glance. Now, this is also Sleep Awareness Week, and the new Sleep in America poll found pain is cutting into not only how much sleep we get, but also the quality of the sleep we're getting. How do we manage to sleep when we're not feeling well?
Well, what's a couple things for folks, for your viewers and for our fellow citizens and patients, is we've seen for many years pain is one of the most disruptive elements to sleep. So we want to increase the awareness of how both chronic pain, which appears to increase sleep debt about 45 minutes per night per patient, and even acute pain, about 15 to 20 minutes per night per patient, can impact their health. It makes them feel pain more acutely. It increases their stress levels, which also diminishes sleep quality and sleep time. So part of this is addressing the pain issues. So we have to work together, typically multidisciplinary with your physician, sometimes a pain physician, helping to address those issues. This starts to raise the issue of incorporating good sleep habits into overall health quality. So what we're starting to see is moving sleep health into the overall health plan. Diet, exercise, and now sleep should be part of what we use to try to live better during the day.
I totally agree. It's so important to how we live and how we function and feel.
It is.
Dr. Joseph Ogile, always great to see you.
Good to see you,
Thanks so much for
Kay.
coming down. Cindy's in the First Alert Weather Center. Cindy, you always sleep.